Are schizophrenics crazy? Now, I'm schizophrenic, so I feel like I can talk about this. Now, there are many things that I have done before I had the right medication, worked my way to the right medications, and before I had a more spiritual outlook on everything. And, these two are very important to me personally. Though you don't have to be spiritual in order to be so-called sane or function in society. You just have to have a positive outlook. If you want to narrow it down to like one phrase, it's very complicated. But if you just become a more positive person and find the right meds, you can live as a perfectly normal person as a schizophrenic. But are schizophrenics crazy? Now, crazy. Now there's a lot of ways to dehumanize somebody, and calling a schizophrenic crazy is a big dehumanization. It's kind of like a racial slur, I guess you could say, because schizophrenia, it's not something that you just gain overnight. I mean, it's genetic for the vast majority of people who have it. It's very much genetic. Schizophrenics, sometimes we have a tendency to use drugs early on or alcohol, try and numb something that other people don't understand, and then that actually makes it worse, or it activates it to a greater extent at an early age. Like, my schizophrenia wasn't really supposed to be, I guess you could say, activated. Like a lot of psychiatrists say that schizophrenia becomes active in the 20s, but mine became active when I was about 15 because I started drinking. Because despite not hallucinating and not I was still able to sleep, I still had the depression of a schizophrenic very early on. So I started drinking, trying to numb this, and so it basically brought the schizophrenia that was inherited in my genes out. And we have to be very sensitive about how we talk about mental disorders. Now, I would label a lot of things that I did as crazy, but every schizophrenic might not feel that way. In fact, most, I don't think, do. I'm very thick-skinned when it comes to somebody identifying me as this or that name, derogatory or dehumanizing as it might be. But many are not. Many schizophrenics are not. Many schizophrenics, we're sensitive by nature. And we don't always develop a thick skin. And a lot of time when we do develop a thick skin, it makes us harder. It makes us less compassionate and less, how do I say this? Less sociable. But none of these things are true for everyone. These are just descriptions that I'm throwing out there off of my experience with other schizophrenics, and what I've learned. And there's a lot of material online about schizophrenia and the nature of the illness, the different types. I'm not really going to get into that. There's plenty of other people that can talk about that. What I want to get into is the fact that society doesn't want to deal with mental illness. It's a subject that nobody really wants to deal with because we still haven't reached a point to where we know how to approach it, even in the first world, even in the United States. Even in pretty well-off neighborhoods like the one I live in, it's still very much misunderstood. When I tell people that I'm schizophrenic, which I tell plenty of people if they ask about something or if they're talking about mental illness, I don't mind telling people. And once again, most schizophrenics don't want to talk about it, but I tell people that I'm schizophrenic or what I've been through, this or that, because I just want to raise awareness about it. And that's just my personal choice. It's not saying that I'm better than any other schizophrenic, it's just my personal choice. But when you see that look in their eye when you say you're schizophrenic, it's funny to me. It's like, oh God, you're crazy. That kind of look like, oh. But and that's because we just don't talk about mental illness enough. Those who go through it, it's very hard for them to talk about it, understandably. And psychiatry, as far as what we know about schizophrenia, it's not really taught in public schools. There's basic psychiatry that's taught in schools, and maybe a little bit about schizophrenia. And in college, of course, there's more in depth. But as far as common knowledge goes, knowledge about schizophrenia hasn't really worked its way into society yet. And that's why a lot of the times schizophrenics are, it's like, oh, he's crazy, or he's insane, or he's unstable. Don't go near him, things like that. Just kind of creates a barrier around us if somebody labels us this and tells other people, and people don't really want to come near us because they feel like we're going to fly off the handle at any second. I've experienced that too. Not recently, because I've been very outgoing in the last few years, but in the past when I was very introverted, when people have found that out about me through one way or another, there is a standoffishness, and I've always been very blatant about my schizophrenia. But when I started developing much better social skills a few years back, that's when people stopped putting that barrier between me and them, because I was just a generally nice person. And it takes a long time for most schizophrenics to develop social skills. And it took me a long time to be able to bear more than one person looking at me and talking to me for more than like 5 minutes at a time. My face would turn red and I feel like I need to leave the room. And even with the medication, it still took many years of learning social skills in order for me to get past that. But the plight of schizophrenics is very real. I don't feel like I'm going through it as much as I used to, but there's plenty of schizophrenics out there that there's not a medication for them. And even the meds that they take, a lot of schizophrenics, it doesn't help to the extent that they seem normal. And that's a real shame. I was lucky to eventually find the right medication, which, once again, I mean, I found the right medication around the age of 20, and I'm 25 right now. Some schizophrenics, it's decades and decades, especially if you can't afford the medication, and psychiatrists that can diagnose you, which is terrible. A lot of schizophrenics end up in jail. A lot of schizophrenics end up homeless, just because they can't get the help that they need. That's one of the reasons I believe that, mental health and physical health, healthcare, should be universal. I think that we have enough money to do it in taxes, but that's a kind of a little bit different topic, though it does affect the topic that I'm talking about, which is schizophrenia. In conclusion, try to be very sensitive towards schizophrenics. Try not to label them, say like, "Oh, you're crazy then," or don't think that they're dangerous just because they're schizophrenic or because they have some mental disorder. Give everybody a shot. And certainly don't call a schizophrenic crazy, even if you're joking. Just don't joke about it. Just leave it as it is. Try to get to know the person. That's my recommendation if you're not schizophrenic. If you are schizophrenic, it's very hard for us to develop social skills, and it's very hard for me. Very, very hard. I mean, I didn't develop good ones until about the age of 20 to 22, and that's very recent. I'm 25, but try to be as personable as possible. That's my recommendation to schizophrenics. Try to reach out, find groups of other schizophrenics, whether it be online or in meetings. Try to work out ways that you can live the best life you possibly can. Try to, if you have the money to find a psychiatrist, it's good. You want a diagnosis. But what has helped me also, which is the other 50% of my mental health stability that I've achieved now, is basically correct understanding of myself, the willingness to analyze myself, my thinking, and the willingness to work past the fear that I'm never going to be normal. Work past all of these fears that we have as schizophrenics. They're very painful fears. They're fears that keep us away from people. Try to work through them mentally, not only just with medication, but address every part of yourself and really fearlessly go into, if you can afford a therapist, that's great. But even if you can't afford a therapist, which in therapy is very important, try to just be more personable with people. Find good friends that you feel you can, talk with anything about. And, just kind of sharing your experiences with people that you become close to can have a great impact on your life. And it has for me. And I would highly recommend it. Just take baby steps if you're schizophrenic. And if you're not schizophrenic, try to give schizophrenics a shot. And that's all I got to say. The title for this video is going to be Are Schizophrenics Crazy? Because I think that dehumanizing title that's placed on us just needs to be addressed, and I think I've at least tried to address it in this video. So thank you very much for watching. If you have any questions, shoot them down in the comment section below. And I'm Hunter Salazar, and I'm schizophrenic. Y'all have a great day.